What is the busiest time of the year for you?
Now, September is a very busy month because those are all the New Year's Eve babies. Yes, Christmas, New Year's Eve babies. They're all born now. And we joke that, April's a busy month too for all of us. We're all pretty busy in April. And for surgery-wise, most people want to get their surgeries done in, if they have to have a little procedure done in November or December because their insurance deductibles have been met. So you don't have to pay for it. But for obstetrics-wise, September is crazy at the hospital.
How has being a gynecologist changed your life?
I've certainly met a great group of women. I consider some of the patients that I've met my friends because I came here from New York and I didn't know anybody, and my best friends were my patients. It certainly has changed the way my children perceive me because I'm a doctor and they're so proud of me, and so are my parents. It's not easy doing 16 years of education because it's 16 years. It's 4 years of college, 4 years of medical school, and then 4 years of training, and then there's constant re-education that has to happen through the years. So I was always pretty confident and extroverted, but I feel very comfortable in my own skin. It certainly gave me the confidence that I've achieved something that only a small percentage of women or men can do. So it kind of makes you feel good about yourself.
As a doctor, do you ever stop studying, or are you always constantly studying?
As a physician, we always can read journals and articles, and we're responsible to get recertified every single year in the specialty of OBGYN. So I have to read 30 articles every year and answer questions, and some of them are not easy, and then you have to get a percentage of them correct. And over 10 years, if you don't score well, then you actually have to sit for a handwritten test. I myself have to stay on top of things because I have a medical student with me every 4 weeks. So it is my job to educate the next generation of women and give them the right information, or as I tell them, I don't want to give you a black pearl. A black pearl is what I think is right, but I'm not so sure, and then it's a wrong piece of information. So if I don't know, I'll look on the internet, I'll look in my textbooks, and we'll go over it together. So because I have students, I have to be on top of everything.
I think you can go because I don't have any questions. Okay, I have one. When teaching the medical students, what's the, I guess we'll say funniest and best part about teaching them?
The best part about teaching them is when they start with me on day one, they don't know how to talk to patients. They are a little confused, like they're in a maze and they don't know where to go. And then I get to see them 4 weeks later transform into, again, a very confident individual, able to ask a patient questions, and then they're able to formulate, what's the plan? How am I going to make her better? I always say to my patients, I'm going to make you better. I can do this. Give them a little bit of confidence, and I can see they started off they couldn't even complete a question or fill out the papers correct, and then in a minute and a half everything is done, and they know how to direct and ask the questions. And I get so proud of some of them that when they leave me, I'm hugging and crying, and I'm I'm so proud of you. And I'm more proud when they choose to become an OBGYN, because that means that they've seen a lot, they've done a lot, and then they do really well on their exams because I know I've prepared them really well to their exams. The funniest thing that they've done, I had one pass out in the room. And my patient was like, she's going down, and she did. And my patient grabbed her arm, and then I grabbed her, and she's like, yeah, not good. And then we laid her down on my couch, and she slept for 3 hours. Yes, she was really tired, but that was one of the funniest things, that she passed out in the room. Yeah. I always tell them, if you're gonna pass out, just get out, but you could just see she was getting green. It was pretty funny. Yeah. And then we laughed at her the whole time.
Okay, what advice would you give someone coming into this field?
Number one, don't do it for the money. That's not the reason why, because the amount of money that medical school costs right now, these days, it's very unlikely that you will pay it off in 20 years. So you're going to do this field because you want to do this and you like doing this. I think medicine is changing so much that there aren't going to be any of these around. So by the time you go to medical school, or if the three of you decide to go to medical school, it's going to be more of a hospitalist, laborist type of a position where you work like my husband does, shift work. So I think it's going to be more appealing to women or people who want to have a schedule, because you're going to work your hospital shift, take care of your patients, and then you're going to go home. So I think it's going to be more attractive. But again, you're never going to make the money that the doctors made 30 years ago, which I had never seen. And you just have to really go in for the right reasons and understand that it is a part of your life that defines you, and being able to balance. You have to be a really good juggler. I taught my son that women are really good multitaskers. Like, we can brush our teeth and brush our hair at the same time, where men are not so good at that. So you have to just be an amazing multitasker to do this job. And if that's something that you can see yourself doing, then definitely go for it. But understand, you're going to lose out on a lot.
What's the common age you see women being pregnant?
Right now, again, in this patient population, this is like an upper middle class patient population for the most part. So it is very rare. I've only had 2 teen pregnancies that carried through, okay? This is south of the boulevard, okay? Or close to almost being south of the boulevard. I'm sure at all of you and in some of the clinics, they'll see like maybe 20 to 25 years of age is your average age group. But my patient population, I'd probably say the average age is between like 27, 28, and 35. Because I have the professionals, I have people who have been to school, the teachers, the lawyers, the accountants, and that's more of my patient population. None. So that's more my patient population.
If you had to do it all over again, would you still become a doctor?
Yes, I would be a doctor. Would I do this? I don't know. I think, my children really haven't lost much, and I made it that they're my number one priority. I've never missed like a school play or a concert or a birthday party where some other doctors have. But I tell my patients, you're having your kids, you have your family, and I've always made them my priority. I think part of me might have liked to do shift work like my husband. Like, if I could work in an NICU and do shift work, but then you lose your autonomy. I lose the chance to, let's say my daughter calls me and says, I'm star student tomorrow, can you come? Of course I'm gonna come. So I change my schedule. Suddenly there's an emergency surgery that I had to do. So my girls come into work and they cancel like my first 5 patients. So everything comes with a price. So if I worked for somebody, I would lose the ability to take vacations when I want to take vacations, to go to my kids' performances or whatever it is that they need me at. So part of me says I wouldn't do this because I'd like to receive a paycheck and not have an overhead, which means paying rent, malpractice, girls' salaries, health insurance, pension plans. Because whatever my corporation makes, I only take personally, if I'm lucky, a third of that home. Yes.
I
Yeah.
thought the percent would be higher.
No.
Yeah.
It's insane what the insurance companies pay you. People think doctors make a lot of money. So if I take care of a woman for 9 months, that's 9 visits minimum. I deliver their baby, if I'm lucky, during the day, but sometimes it's 2 o'clock in the morning. Then I see them every day in the hospital. Then I see them at 2 weeks and 6 weeks. I'm lucky to get anywhere between $1,700 and $2,000. My girls, my medical assistants get paid very well. They're very smart. My medical students get paid $23 an hour a piece. So figure out in a 40-hour work week what their salary is going to be. And then I've got $6,000 a month in rent. It's not a lot. It's not a lot at the end of the day. We do it because I love my job. I love doing what I'm doing. But sometimes I would like to not always worry about Christmas. Who's going to cover me on Christmas? Who's going to cover me on Thanksgiving? I don't get holidays. Not unless I share them with somebody. So, I don't know.
I think that's all the questions we have. Oh, I have one more.
Okay.
Okay. What motivated you to decide that you wanted to do gynecology?
I have really small hands. Like, seriously, I have incredibly small hands. And when I did all my other rotations, your third year of medical school, you go through every single like normal like practice of medicine. So you do pediatrics, you do internal medicine, you do general surgery, you do psychiatry, you do OBGYN. So you spent like 6 to 12 weeks, depending on the rotation, in there. And I got sick all the time. I did pediatrics, I had strep throat. I did internal medicine, I got pneumonia. So I said, I cannot deal with sick people because I'm going to be sick all the time. And then when I did my surgical rotation, I operated with those surgeons, and I had the best time operating with those surgeons. And then I started to do more OBGYN electives, and somebody said to me, you have the tiniest hands. I was like, this is so the field for me. So part of the motivation is that number one, I was dealing with women. I didn't have to be, limited as to what I spoke and how I spoke, and I didn't have to feel limited as to, needing a chaperone all the time, and the fact that you could tell me and I could speak to you, and I've been there. The fact that I was a really good surgeon operating in a very tiny space, because a lot of the surgery we do on women, we do through their vagina. So I'll do vaginal hysterectomies where I'll actually remove a woman's uterus out through her vagina. So you can have gigantic hands and do that.
Yeah.
So, and my patients appreciate my small hands. I'm like, oh my gosh, you have the tiniest hands. So it's all good. It's all good.
That's all the questions we have.
So you guys all do medicine, or some of you nurses?
Medicine.
Medicine. I want to do surgery.
Oh, you do want to do surgery?
Yeah.
It is a really rough lifestyle. It is. It's so competitive. And then you have to be like subspecialty. So if I had to do it again, I'd be a nurse. I will tell you, I have friends here, good friends, but the nurses will stand by each other like a unit. They have each other's back no matter what, like your best friends, even if you just started working yesterday. And there's a camaraderie amongst nurses that you rarely find amongst physicians. And a charge nurse will make the exact same amount of money as a pediatrician, an internal medicine doctor. And they don't have to fight for their jobs. They work their 3 shifts, they go home, and they're done. And they cover each other. If one wants to work a half a shift, they'll cover each other's half shifts. I have 2 female friends who are OBGYNs with me, and we cross-cover each other. So I go on vacation, the other one goes on vacation when I come back for the holidays. She's Jewish, I'm Catholic. I get Christmas and Christmas Eve. She takes the more Jewish holidays, and I have her. She takes a lot of vacations, I don't take that many. So she knows that whenever she wants to go, I'll take care of her patients the same way I would take care of them as my own. But if I had to do this all over again, the amount of money you make in nursing now is sometimes even better than what I take home at the end of the day, especially in the charge platform. Surgery is 5 years, and I am kind of the anti-feminist in the sense that you are taking the spot from a man when you go into a residency program. For a 5-year residency program in surgery, you're going to be on call, depending on what rotation. Trauma is normally 24 hours on, 24 hours off. If you decide to get pregnant during your 5 years of residency, somebody else needs to take that spot from you. So it's not like, oh, no one's working today. So instead of being on maybe 1 and 4 or every other, that person needs to do like 24 and 12. So I belong to this Dr. Women's group, and yeah, I understand we deserve the right to get pregnant, but dude, don't make me work any harder than I have to work during my residency program. And you're gonna lose out, because for those 12 weeks that you think you have off because you had a baby, you don't have off 12 weeks. I'm back at work 2 weeks after I have my kids. I do not work, my girls do not get paid. I do not work, my patients will go somewhere else. Okay, so it's really tough, super tough. Like, I don't get to enjoy, 6 weeks off,